Deputy Speaker.
I call the member for Noosa.
Thank you, Deputy Speaker. It is increasingly obvious in multiple realms that there are issues surrounding early intervention, especially with our youth. Prevention is key, whether in relation to crime, mental and physical health, school attendance or disruptive behaviours. Our home environment is the first touchstone for interventions, with the next safety net our schools, family and friends and our communities. With increasing numbers experiencing housing insecurity, there is also instability from the mental health and addictions in households. The frustrations of communities who have individuals sleeping rough with their children who are offered accommodation yet refuse is just one example of where no agency can force a resolution, which in itself is an early intervention. Currently, it appears that interventions only occur once a crime has been committed, which in many instances is already far too late for these children. To our schools, reports from teachers that they have increasingly become disempowered to provide parameters for our youngest Queenslanders is of concern. With no ability to prevent disengaged students walking out of class when they choose to, the ongoing time demands of those displaying antisocial or problematic behaviours, and a system that does not provide constant whole-of-life monitoring and mandatory pathways to address these is creating a domino effect of teacher attrition rates and student absenteeism. Teachers and parents of these students need greater support and options beyond fragmented delivery and oversubscribed programs that are mostly voluntary. With vast volumes of reports, papers and inquiries identifying early intervention as key in prevention, whether behavioural, mental health or criminality, we need to ask ourselves, why are we so late in the early equation? There is also the question of why recommendations from these appear to fall by the wayside or are only partially implemented, including geographically, widening the gaps being experienced across the state. Budgetary constraints are often part of the excuse. However, let's look at what it costs to not intervene early with our children to prevent disengagement and the resulting trauma. Lamb and Ho from the University of Melbourne calculated both the lost opportunity and the fiscal and social costs, which included lost tax payments, increased public expenditure on criminal justice and corrections, health and support programs and welfare. These costs did not include things that were harder to quantify, such as the provision of housing or care for young people, or the considerable economic costs borne by non-government and philanthropic organisations, nor do they include the intergenerational cost of disadvantage. Prioritising early intervention in budgets ultimately saves not only dollars, it saves lives. Let's ensure that when budget considerations are made at every level of government to move beyond the cost of an election cycle to one that expands a lifetime. Speaker.